Good afternoon. I'd like to welcome all of you today to Coordinating Early Childhood Data Policies, Opportunities for States webinar. My name is Carlise King. I'm the Executive Director of the Early Childhood Data Collaborative and your facilitator for today's webinar. Before we begin, I have a few housekeeping items to review. A recording of this webinar and a copy of the PowerPoint slides from the presentations will be available on the Early Childhood Data Collaborative website. An email will be sent out to all of those who have registered after the materials are posted. Due to the large number of people we have participating on the webinar today, the call will be muted for all attendees. You can submit questions throughout the webinar using the question box located in your panel. We will respond to questions between presenters and at the end of the call. The goal of our webinar today is to highlight requirements, provisions, and guidance from the Child Care Development Block Grant Reauthorization, the proposed Head Start standards, and Every Student Succeeds Act, specific to early childhood data collection and coordination to inform policies and service delivery. I have on the phone with me today 3 incredible experts in each of these areas who will guide us through what and how states can leverage these changes to increase collaboration and data sharing across early care and education programs. The agenda for our webinar today will first be to give you an overview of the Early Childhood Data Collaborative and what we see as the benefits of integrating early childhood data about children, families, and programs. Next, we will hear from our 3 presenters. We are pleased to have Hannah Matthews, the Director of the Child Care and Early Education team at CLASP. She will share data opportunities from the Child Care Development Block Grant Reauthorization. Emmalie Dropkin, the Director of Policy, Data, and Research at the National Head Start Association, will highlight guidance from the proposed Head Start standards. And Danielle Ewen, from the Senior Policy Advisor at the Education Council, will identify strategies for coordination between early childhood and education agencies that take advantage of opportunities within the Every Student Succeeds Act. We will take questions at the end of the presentation, and at the end of the webinar, we will respond to all questions from the audience. As I mentioned before, please feel free to submit your questions throughout the presentation. So before I hand things over to our first presenter, I want to quickly share some background on the Early Childhood Data Collaborative. The Early Childhood Data Collaborative was established in 2009 with the mission to promote both policies and practices to support the development and use of coordinated and longitudinal early care and education data systems in order to increase children's access to high-quality ECE programs, to improve the quality of those programs, and to address workforce development needs. Our goal is to ultimately ensure the positive development of our most vulnerable children. Our goal is to help states and policymakers transform data systems that have traditionally been used to comply with funding reporting requirements to improvement-driven data systems, which can provide feedback that can be used to guide decision-making and policies at all levels. To do this, state leaders need comprehensive data on all early childhood investments in order to identify gaps and to track progress. ECDC over the past 7 years has documented that most states' data systems are fragmented and not able to connect data about young children because these data are housed in multiple systems, uncoordinated, and managed at different state and federal agencies. For example, children, families, and staff in Head Start, information about them are tracked and scored differently compared to services offered through state preschool or subsidized child care. This means data that could help policymakers answer critical questions around program access, workforce development needs, or school readiness are not accessible. But there has been progress in states, and the following presentations will highlight opportunities to build from the progress that has already been made. Coordinated data across early care and education having coordinated data across early childhood programs and having policies to understand children's early experiences regardless of the program door that they come through will help policymakers have more accurate information about access for vulnerable populations, the quality of programs and their distribution throughout the state, and this will help us know how well programs are working to achieve their goals, and what exactly is being achieved. It will also give us a more complete understanding of workforce preparedness and state needs for professional development and training. Having cross-sector and longitudinal data to assess progress over time will help us identify trends, areas of growth, as well as decline. I will now hand over the presentation to Hannah Matthews, who will share opportunities offered through CCDBG. Thank you, Hannah, for joining us today.
Great, thank you so much. I'm happy to join today to talk about the CCDBG reauthorization and implications for early childhood data coordination. The Child Care and Development Block Grant, or the Child Care and Development Fund, next slide, is the major federal funding source for child care assistance for low-income families and also for initiatives to improve the quality of child care for all families. In November of 2014, the law was reauthorized for the first time in about 18 years with some major changes. You can see here the goals of the reauthorization fall into two categories: to improve overall the health, safety, and quality of child care, and to make child care financial assistance a more stable support for families in order to support continuity of care for children and stable employment for families. CCDBG is a block grant that has always afforded states a large degree of flexibility in establishing policies. The reauthorization created many new requirements for states while maintaining state flexibility in many areas as well. Importantly, the reauthorization did not guarantee new funding to comply with requirements, and some have significant costs. Without additional resources, these cost constraints will hamper states' abilities to fully seize all of the opportunities in the new law, including making the most of coordinating data. Next slide. You can see here the timeline for implementation. The law was passed in November of 2014. The Federal Office of Child Care issued a Notice of Proposed Rulemaking or Proposed Federal Regulations to implement the law in December of 2015. Simultaneously, states were working on their state plans, which is a means of tracking how states intend to implement the new law. State plans were submitted in March and then were approved and became effective last month in June. States were asked to use their best interpretation of the law, as proposed federal rules are not binding yet. We anticipate that a final federal regulation will be released this summer or fall. States must be in compliance with most provisions of the Act by October 1st, other than those specific provisions that have delayed effective dates that were laid out in the law. If you look at the final approved state plans that are available now on the Federal Office of Child Care website, you'll see that many states have state-specific implementation plans, which in some cases include time-limited waivers in order to have a bit more time to make changes and come into compliance with the law. So in each state, kind of where the implementation is really varies. So next slide. Before I get into specific CCDBG data requirements, I wanted to offer some thoughts about the opportunities they bring. New reporting requirements in the law really offer an opportunity to better understand the characteristics of children served in CCDBG in some important ways, and I'll go into more detail on those. Data reporting in CCDBG has also improved to include data on the quality of CCDBG funded care so that we understand more about the settings that children are in. And finally, there's an opportunity to better understand access to CCDBG in particular communities, and especially in high poverty areas. Some states have used mapping and other techniques to really try to understand this relationship between access to subsidies and the use of particular child care settings, and there'll be more opportunity for that. For states that are considering the use of data and looking to go beyond compliance with the law, there's an opportunity to use the new law to expand data coordination with other programs, and also to really improve data-driven decision-making. And this is something that hasn't happened a lot in many state subsidy systems, but it's certainly important now as states undergo major changes to make sure that those changes are tracked and evaluated with data. So in terms of specific requirements, for child and family level data, states must use a unique identifier for the head of the family unit. The ACF 801 is the monthly caseload report that states submit to the federal government. This is the reporting that currently includes information about children served, so for example, their race and ethnicity. You can see here new data elements that will be collected and reported beginning with this coming fiscal year, 2017. Whether or not a family is experiencing homelessness, the new law included many provisions on improving outreach and services to homeless families, so this is an opportunity to track receipt of services for this population. Also, whether a child has a disability, another population that was identified in the law. It will also include the primary language spoken in the child's home, and this will provide richer data on children's home language and also allow for comparisons with other programs. This is the same data element that Head Start uses, for example, in its program information report. The data will also include parents' military status and finally family zip code. And that zip code data helps contextualize the reach of CCDBG assistance by geographic areas. In terms of provider-level data, the monthly caseload report has also been updated to include quality information on providers who are caring for children in CCDBG. So if a provider is participating in a quality rating and improvement system, it will include their rating. In a state without a QRIS, states will report on whether providers meet quality standards related to accreditation, whether the provider is meeting pre-K standards or other state-defined quality measures, or whether the provider is meeting Head Start or Early Head Start standards. The Act also requires states to have training and professional development requirements and a progression of professional development for CCDBG providers. What specifically will be required of states under those provisions will be clarified in a final rule, but here there are also data implications in terms of tracking that training and professional development for providers and creating that system. States will also be required to have a consumer education website. On that website, states must include provider-specific information on results of monitoring and inspections, and also on the quality of providers, as I mentioned, if information is available. The website is also to contain consumer information for families, including information about other child care and early childhood programs and other public benefit programs, such as nutrition assistance, SNAP, TANF, WIC. This is another area where the requirement alone will not facilitate the coordination of data, but if states make the most of developing a new website and new technology, there are many opportunities to really expand their vision of how data is presented to families, how programs are coordinated and interact from the family's perspective, and how the state is better coordinating its data across programs. In terms of systems level data, as I mentioned at the beginning, there are many provisions in the law that are about improving the quality of childcare, and data can certainly be an important part of that. The law requires states to use strategies to increase supply and quality of childcare for particular populations, such as children with disabilities, children who receive care during non-traditional hours, and it also requires states to prioritize investments in high poverty areas. So coupling the quality data and the zip code data will really help to get at where families are accessing higher quality care, and of course the extent to which high poverty areas are getting access. The law also requires states to create measures to evaluate progress in improving the quality of childcare, and the proposed regulations requiring reporting on those measures. So here's another opportunity to improve data and use data to better understand state quality investments. Before I conclude, I just want to offer a few comments, not on specific data requirements, but larger opportunities in the law. There are many new aspects of the law and implementation that could be leverage points for attention to more coordinated and more effective use of data. The law has new goals, for example, around increasing the number of low-income children with access to higher quality care. There will be increased coordination requirements in state plan development going forward, and as I mentioned, many provisions around building the supply of high-quality care. So all of these can be maximized if states are using data to understand their current system and the changes needed. To give just a specific example of that, the types of changes that can be leveraged for data coordination. The many improvements in the subsidy program in the law offer some opportunities here, and specifically one that many may be familiar with is minimum 12-month eligibility. This makes it easier to link and align programs such as child care and Head Start or child care and pre-K. It's also an opportunity to link with other benefit programs. So some states, for example, have coordinated their child care program with their SNAP program. And data can be a very big piece of cross-program eligibility or enrollment or other integration of services. I also think that if we look at the increased stability and the reduced churn that we expect children in CCDBG to experience with these improvements, if you couple those with data improvements, it can really help tell a richer story about young children's early childhood experiences. Prior to the reauthorization, as many of you know, children churned in and out of subsidies, getting help for only a few months at a time. As the program becomes a more stable support, there's really an opportunity here to better understand over time the type and the quality of child care access, how family characteristics may change over time, and generally get a better understanding of how CCDBG impacts the lives of children and families. And I think we'll pause now and see if there are questions.
Thank you, Hannah. I've been monitoring the questions. We don't have any additional questions right now, but if folks want to submit questions, we will do another break for questions after our next presentation. Thank you, Hannah.
All right, great. Can you hear me clearly?
Sure. Yep.
Wonderful. This is Emmalie Dropkin. I'm the Director of Policy, Data, and Research with the National Head Start Association. And I was asked to talk with you today about some of the recent changes in Head Start and how they may affect communities and states moving forward. Next slide. So before I get into this, just to be clear, the changes that we're talking about in Head Start are not the result of a reauthorization of a new version of the law. They're really, at this point, regulatory changes to the Head Start standards. Although we are starting to look ahead to the next time Head Start gets reauthorized and think about how can we make changes that support effective use of data. But so here's what it looks like. This was a product of the National Center on Program Management and Fiscal Operations of the program planning cycle. Thinking about how in each Head Start community there is a lot of data activity that's already happening, that over each 5-year grant that a program holds, they're setting goals for their organization, for the children, and the outcomes that they want to achieve for those kids and their families. And to meet those goals, they're going through what we think of as a typical cycle of continuous quality improvement. Developing the plan to meet those goals, implementing it, looking at how it's going, using data to make course corrections, to decide how to achieve stronger outcomes, continuing to reflect, continuing to update the goals. And this also is always informed by a local community needs assessment. So for example, a program may decide that they have a high instance of children whose parents are incarcerated, and that's really something that they want to make sure that they're enrolling those kids and supporting those families and helping to build strong supportive relationships and to help the children cope with that, with any attachment issues they're facing and be successful. And that may be a goal that they set. They may put a plan in place, continually refine it, look at those children, how well are they doing it, identifying and enrolling them, how well are they doing it serving them, and reflecting on that continuously. Next slide. And so it is complicated. This here is a product of a study called the Head Start Leadership Excellence and Data Systems Study that the Urban Institute carried out for the Office of Planning, Research, and Evaluation just a couple years ago. And in the top of that of the roof there, you see that same continuous quality improvement cycle in slightly different words, but really focused here on all of the different systems and components that exist in Head Start and in many other kinds of early childhood systems that are essential in order to fully implement effective data use. And I think that as you look at the context in which data analysis is happening in different early childhood spaces, a lot of the challenges often come from those pillars, where we see challenges in the staff time, so the leadership commitment, the just the sheer technological capacity and the knowledgeable staff who can use those systems well. Those are all different pieces that the Head Start community has been working to improve, but often with limited resources, we know that there are many opportunities to strengthen those capacities. And that's certainly part of the Moneyball for Head Start report that NHSA put out with several of our partner organizations this January, was looking at how the federal government can better invest on a lot of those different levels. Next slide. So I touched on some of these pieces already, but current data use in Head Start is locally designed and driven. Hannah mentioned the Head Start Program Information Report, and if you're not familiar with that, it's a very, very, very long survey that every Head Start program completes every year. And there's other data that they submit to the federal level as well, a lot of which falls into those input and output categories. And I expect many of you on the call are familiar with those terms, but just for anyone who isn't, we think about the inputs as being the structural components that go into the design of the program, how many children are enrolled, how many teachers are there, what are the teacher degrees that they're coming in with. And then the outputs being the quickly quantifiable results that don't necessarily tell us about a change in behavior. So how many children got a physical? It doesn't tell you whether their health is actually improved. It doesn't tell you whether they've gotten the appropriate follow-up care. It tells you one thing that we could quantify in that day. Or how many meals were served in classrooms. It doesn't necessarily tell us if the children ate them or if the children's health or nutrition were better as a result, but it is something that we can quantify easily. Programs do collect a lot of outcomes on the local level because they meet those local goals that they've set for themselves, or the data collection helps them to understand whether they're meeting those goals that they've set for themselves, but they're not aggregated in quite the same way at the federal level. And so and just to define outcomes briefly, those are the places where we're thinking about behavior change, where we're thinking about looking for changes in learning or behavior or development that a program would be able to measure within the program year. So increases in vocabulary, decreases in obesity status, appropriate developmental milestones, those sorts of things. And all of those data are important. We just don't want to lose any one piece in favor of the others. And programs are then using the data for continuous quality improvement, for community planning and local design, and for federal reporting. And we know that in order to analyze, collect, report that data, some programs have dedicated staff person, but particularly among smaller programs or programs that aren't part of a larger umbrella organization, like a major community action program or school system or government agency, some of the smaller ones really don't have the scale to fund dedicated data staff. And we know that there are also additional data requirements placed on a lot of programs for their quality rating and improvement system, for their state longitudinal data system in some states, for their early childhood integrated data system in some states, and sometimes with other Head Start programs so that they can better understand their own results in the context of their peers and in comparison to other people serving the same populations. Next slide. There are a lot of political forces at work when we look at data, and I'm going to go through these quickly because I'm only have a few minutes, but I think those of you who've worked in the Head Start community are sensitive to these. We know that data can be misused for accountability. Especially in the Head Start community where we're enrolling the very most vulnerable children in a community, we know that their developmental trajectories can look different than other children while still being successful and healthy for that child. And so I think there are a lot of concerns in the Head Start community that if they're sharing data, that it be taken in context and that it really be sensitive to the population that they're serving. Next slide. So just to look quickly at some of the changes in the Head Start program performance standards that have been proposed. And I want to emphasize that these are proposed. This is a set of standards that were released last summer. And the Administration for Children and Families, which is part of the Department of Health and Human Services, has repeatedly said publicly that the final standards are expected sometime this summer, but they don't get any more specific than a season. So we'll see when those are out. And so what you'll see here on this first page is that there is a big focus, as there has been to some degree in the past, on the idea of continuous quality improvement, which here they call program management and quality improvement. A couple pieces that are mentioned here are about having data governance in what may be a new way, and what we're interested to see how that is developed and plays out. Next slide. Oh, so there's the piece about data governance. The other new piece is encouragement to integrate Head Start data with other systems or sources to the extent practicable. Really with this idea that we know that Head Start programs in local communities are not working in isolation from pre-K, from childcare, from other early childhood parts of the system, special ed, early intervention, all of that. And it certainly helps us to understand Head Start's impact and Head Start's long-term findings when we can see and track what happens to Head Start children and how the combination of all the experiences they have throughout their education affect their long-term outcomes. But again, with the importance of really thinking about what their risk factors are and what healthy development and learning look like for those kids. Next slide. The pieces about privacy of child records, I'm not going to get into in too much depth because they are primarily similar to FERPA, if you're familiar with education privacy requirements. And I think the exciting thing for the Head Start community here is that we have not had in the past any real clarity about exactly what the privacy of child records should be in Head Start, except that the Head Start Act said the Secretary should come up with something similar to FERPA. So here we have it, and I think this will just be an issue of getting these implemented and providing clarity to the field and understanding how it intersects with FERPA in the case of grantees who are or are working with school systems. Next slide. So finally, some of the opportunities that are ahead of us include the way that the Head Start program monitoring is amended to take the new standards into account. We know that some of the monitoring for this fall will be on hold in certain areas as they work out as they release the final standards and begin to figure out how to amend the monitoring system to monitor the new standards accurately. We know there will be new governance structures created at this program level, which create opportunities for programs to think together across the state and federal level about how that can be done most effectively. The data sharing standards, which are part of that privacy section, certainly clarify a lot of issues we've had in the past about who can share what with researchers and for what purposes. And I'd encourage anyone who hasn't seen Moneyball for Head Start, which we released this January, to take a look at that, because I think it certainly will be a framework for some of our conversations as we move towards the reauthorization of Head Start again. Next slide. Finally, I think as we look at the new standards, we're also thinking about all of the other policies that are changing in the early learning space. We're looking at the data training and the other data systems that are part of the Head Start context and how we can appropriately be part of them. And again, just thinking specifically about Head Start children and what may be different in their circumstances. Next. All right. Any questions?
Thank you, Emily. We've had a couple of questions, and so we have time to do one. And so I'm going to try to summarize a little bit. So there were several questions about the health reporting requirements that you asked. specifically if they align to any other specific standards or recommendations in Head Start.
Health?
The health reporting element, if they aligned with CHIPRA core set, or people listed other examples.
So the program information report calls for some health pieces that I don't believe are directly related to anything else, but that ask about children's insurance status and vaccination status, both at the beginning and the end of the program year, about their healthy weight or obesity status at the beginning of the year. There's other information that's collected at the local level in order to ensure that they're helping families to access, as they are required to, a medical home for their child, and healthcare access for the parents if that's part of their family partnership goals for the year. But I don't know how closely any of the local data tracking would align to other systems.
And there was another question that specifically asked about the alignment to the well child visits.
So the programs are following EPSDT, the episodic, no, what is it? It's the periodic screening, and I'm going to get the acronym totally wrong if I try and say it. But they are following the state EPSDT schedule for their children and helping families to be up to date on all of those expectations.
Okay, thank you. We had a couple more, and then one came in for Hannah earlier, but I'm going to hold those until after Danielle's presentation. So I'm going to hand things over to Danielle right now, and then we'll open it up to all the remaining questions. Thank you,
Great.
Emily.
Mm-hmm.
Hey, Carly. Thanks so much for having me today. I'm excited to talk to everyone about the Every Student Succeeds Act and how we can leverage the opportunities in the Act to build new birth to third grade systems. I want to highlight sort of a theme of what I'm going to talk about. Both Hannah and Emily talked at the end of their presentations about opportunities and ways to really use the new language either in the regs or in the new legislation to push opportunities to leverage systems. I think when we're looking at the new Every Student Succeeds Act, that the theme really is we're pushing the language in the legislation from the beginning to think about how to build systems that include high-quality early childhood programs serving children from the very beginning through their entry into early elementary and beyond through third grade. So that's sort of a theme I hope you'll hear throughout my comments. If we can go to the next slide, I wanted to give just sort of an overview of the new law. Many of you have already heard this. We're about 6 months into folks paging through the 1,000 pages of the new law and hearing presentations like this one and others. But it's worth noting again that the new law shifts authority from the federal government back to states and local districts to design education systems that best meet the needs of their children, families, teachers, and school systems, and let states set their own visions and then create systems through accountability and other measures that will meet those visions, that will help them achieve their goals for their kids and families. At this point, we're still waiting for lots of ways that the Department of Education is going to interpret the law. There is currently a set of regulations that are out. There will be more regulations out for notice and approval as time goes on. But over time, regulations guidance and the ongoing implementation will provide new opportunities to really figure out how this law can be used to move outcomes forward for kids. A main tenet of the new law is continuous improvement, and the hope is that states and local communities will continue to look at data on their children and families and understand how they can do better, how they can introduce new evidence-based interventions, how they can change what they're doing to really drive better outcomes for students. And that presents real opportunities to include early childhood interventions into the systems that are being created, as I said. And that is both inside and outside of state education agencies and local district agencies to really help think about where early childhood fits in. If we can go to the next slide. Just so folks have as a reference, early childhood appears in the law in lots of different ways. It is largely a K-12 law. Language around early childhood is really woven in to create an opportunity to think about learning beyond or earlier than kindergarten and then through 3rd grade. References include focusing on transitions for all children between and across different grades. Transition is not defined in the law, and so it can mean moving children from pre-kindergarten into kindergarten. It can mean moving kindergarten into 1st, 2nd, 3rd, and so on. The law also talks about enhancing early childhood quality and how the different titles of the law and the money that comes with them can be used to enhance quality. There are numerous references in the law to improving coordination between local education agencies, individual schools, and existing early childhood programs. This gives us a lot of opportunities to think about ways to better serve children and to use the flexibility in the law to really think about what that means to create systems. Overall, and as we're thinking about data and data systems, these create opportunities for new conversations about how we connect these different systems and the pieces of what we know about children and families, and really how we can use the opportunity to build better data systems that tell us what we need to know about programs that are available in individual communities, about what children are learning, what teachers are being exposed to in terms of professional development, and so on. So if we can go to the next slide. It's important to think about this, I think, in 3 ways. 1, how can ESSA support the efforts to have the systems talk to each other? 2, how can we work state longitudinal data systems into this conversation and expand them to include early childhood? And 3, what state activities outside of specific data systems can support integration and coordination of data? And I'm going to talk to each of those 3 points if we can move to the next slide. Before I do that, I wanted to talk a little bit about the data reporting requirements that are in the law. And Katie Haycock, who many of you know is an expert in thinking about equity in education, testified in front of Congress in February, and she made a number of points about the data reporting requirements in the law that I just wanted folks to be aware of. And they're outlined here on the slide. But you can see that states have to adopt standards that are aligned across post-secondary work, that there are assessment standards. There are clear requirements for accountability that look at subgroups. If we can go to the next slide. That states have to look at inequities in how students get teachers, that we target funding to the highest poverty schools and districts, and that across the board we get much better reporting on academic outcomes for all groups of students. And I think for this one is the most important for the early childhood community. If we can go to the next slide. As you look specifically at some of the data reporting requirements and what states and local communities will be dealing with, one analysis I saw suggested that there are more than 300,000 items for states and local communities to report on. Many of you hopefully just gasped when I said that. I think that is an exaggeration, but it's an important way to think about the fact that there is reporting on lots of different pieces and that there are subgroup reporting. And you can see here on the slide all the different kinds of things that states and local communities have to report on. Importantly, schools have to report on suspensions and expulsions, which is important for preschool, as we've seen from the Office of Civil Rights data. They have to report on the number and % of students enrolled in preschool programs. Preschool is not defined. And they have to do lots of other things, if we can go to the next slide. Again, importantly, thinking about other priorities in other programs, Hannah talked about the push in CCDBG to give new data on homeless children and other subgroups. You can see again here that is one of the subgroups that is important for accountability, and that states can start thinking about what the implications there are for early childhood. And then you can see the last 2, graduation rates are reported. And finally, data on the indicators of school quality. There are lots of folks trying to think about whether and how school quality measures could really be used to think about improving the quality of early childhood programs, whether it's using CLASP and looking at aligned data collection across the board from early childhood into K-1-2, if some of the other evaluation indices of teacher effectiveness could be used to align from early childhood into K-1-2, this is an opportunity as well. So we can go to the next slide. So in thinking about specifically data systems, how can ESSA support systems to have early childhood and K-12 systems talk to each other? Going to the next slide, I think there are a couple ways that the language addresses this question. You can see here on the slide, first, states are required to describe in their plans how they'll support LEAs and schools that use direct funds to pay for direct services. So as states are working with local school districts to make this decision, they should be asking questions about what kind of data the school district has used to decide they need to use funds in this way, how are they collecting information on children that are served with Title I funds, what kind of services are made available to those children, and so on. Again, parent and family engagement is a focus of the law. What information is being collected about how local communities are being served through family engagement. Finally, the language routinely encourages support for transition. What does that mean? What kind of information do we have on community-based providers and schools? What are we doing to support transition? Importantly, this could really be used to think at the local level, not just about moving children between and among settings, but how are we collecting data to understand what kinds of programs are in a community around a particular school or within a school district. Hannah talked about the focus in CCDBG, and Head Start also focuses on a needs assessment to understand where low-income communities need more providers. Can we use this requirement in ESSA to gather more information about where providers are, what kind of quality they have, and which children are being served? Next slide. A second question to think about as we're approaching the implementation of ESSA is whether state longitudinal data systems can be expanded to include early childhood data. Going to the next slide, we can see some opportunities. The legislation requires and encourages coordination at the state level in reporting data, in working with Head Start, in local service delivery, and in thinking about how charter schools start to begin to include early childhood students in preschool in their delivery. And it creates an opportunity, I think, for states and local districts to think about whether there are unique identifiers that can be used across different systems to link children, to understand where children have been, the kind of services they've gotten, and to help them access other programs such as Medicaid, state pre-K, and other opportunities to improve their outcomes. Again, this is something we can use to link to some of the goals in both Head Start and the new CCDBG legislation. Moving to the next slide, as we think about the state longitudinal data system and expand it to align with some of our requirements for K-3, states have to think about building new accountability systems over the next 18 months. They must include multiple measures and separate those measures by subgroup of students. What can we include from early childhood that will give us improved information about young children that can help teachers improve teaching and learning for young kids, can help understand the outcomes for children, and can help drive resources to where children need them most? And that might include kindergarten entrance assessments, developmental screenings as part of the accountability system, assessments of teacher-child interactions, and other things. And again, very specifically thinking about, as indicators and data are put onto dashboards and report cards, how can we link in early learning and K-12 data? Specifically, can we gather information about things like chronic absenteeism? Can we think about how to better understand information about suspensions and expulsions in early childhood? For example, we already know that in the subsidy system, we collect information about when children are absent to some degree. Head Start collects that information to some degree. Can we expand our state longitudinal data systems to collect information on children as early as possible so we can identify those children and families where chronic absenteeism is a problem and deliver resources to them so that we can get them into classrooms to be healthy and safe and get the teaching support they need to be successful. Moving on to the next slide, for instance, assessment is also part of building strong data systems. As states are building those systems, much of the focus is on grades 3 to 8. The question for early childhood is, where can we fit in the information from developmental assessments from pediatricians and other health providers into assessment? How can we use that information to help understand what children and families need? And how can we make sure that we have authentic assessments that incorporate the full range of development for all children, whether they're in traditional early childhood or even when we're thinking about K1, 2, 3? And how can we align those expectations so that assessments take into account those developmental domains and are matched to standards that don't just address literacy and math, but also address the full range of domains? Moving to the next slide. The last question we want to address is whether there are state activities outside of the data systems that can support integration and coordination. Moving to the next slide, I think the big opportunity here is in the new preschool development grants, which are very different from the existing preschool development grants. They are largely about coordination. This gives us a chance at the state level to really think across the early childhood community and the K-12 community about where there are opportunities for alignment of data, of service delivery, to do needs assessment across different communities, and to really understand where the gaps are in service and to create a system that will help meet those gaps and plan for the future. Going to the next slide, the other opportunities are, I think, in school improvement. States and local districts have to identify schools that are in need of improvement by a variety of measures. As they do so, they need to define interventions. Obviously, high-quality early childhood programming can and should be one of those interventions. But I think more importantly, once schools are in need of intervention, they must do a needs assessment of what is available to that school community. And it is our hope that states will help local districts think about a needs assessment that is inclusive of information about the early childhood community around that school. So for instance, which children have access to high-quality early childhood settings? Where do those children live? Are those full-day, full-year programs? Are there long waiting lists for the highest quality programs as the state or the local community defines that quality? Are different groups of children getting better access to high quality? So for instance, are children below 100% of poverty served through Head Start, but children between 1% and 200% aren't able to access high quality? These are the questions we hope that the needs assessment will help answer, and we'll collect data for the school district and for the state to again identify where resources are needed. Going to the next slide. Just a plug as states are doing their ESSA implementation plans to really remember that stakeholder engagement is a core part of implementing the new state plans, and that the early childhood community can and should be involved in developing those plans and can help make these connections to data systems and to places where there are opportunities to link to early childhood data, to expand the knowledge about what's going on in the early childhood community through building better data systems, and to get new ideas for how to better coordinate with early childhood data and K-12 data. Going to the next slide, I will also remind folks that continuous improvement is built into the ESSA implementation plan, as it is with Head Start and other programs. And so we hope that looking at early childhood data, not just children's outcomes, but really these ideas around needs assessment, around some targeted data points like suspension, expulsion, and chronic absenteeism, will help states really think about how to continue to build K-12 systems that are linked and aligned with early childhood programming and support for young children and their families, and that really build a bridge from birth to 5 programs into kindergarten and first, second, third grade and beyond. I think that is the end of my presentation, and I look forward to any questions.
Thank you, Danielle. We had one question that came through. As K through 12 education has been working on developing data systems to inform instruction, are there any lessons that have been learned that you think might be useful for early childhood programs?
Oh, I think there's lots of lessons learned. Thank you so much for asking that. I think that one of the lessons learned is that we just haven't really thought about even K1, 2, 3 in building those data systems beyond basic demographic data on children, and really thinking about how to create opportunities to open data systems up to providers who are outside of the traditional school building is a big piece of that conversation. So one, making sure that the data that is currently collected is looked at for the earliest years of elementary school, and there's analysis that's associated with that. And two, that they're not built in such a way that they're closed systems, that we can't use them for continuous improvement and to add in new data pieces as we move forward and start to understand what's important for kids and families. And three, a lot of the time states have said that longitudinal data, that early childhood is part of longitudinal data, at least for pre-K, and at the provider level, whether that's the kindergarten classroom or a school or even an LEA, sometimes that data is very hard to get back out and see in a useful manner that can be translated into action. So really thinking about whether and how the data that is in the SLDS can be used by local school districts.
And Danielle, an additional question. How has the process of collecting data itself influenced instruction in both positive and perhaps challenging ways?
Oh, that's a great question. The first thing I would say is to remind people that data itself is not an endpoint, to always remember why we're collecting data and how it's going to be used. What we have found in other places is that data from pre-K through third grade is often collected, but it's hard to use for teaching and learning. And so if the data itself is not directly related to what's going to go on in classrooms, it's not particularly useful. I will always also say that data collected in one grade, whether it's a pre-K classroom, a kindergarten classroom, really needs to be translated up and down, and that includes expectations for what children should know and be able to do at the beginning, middle, and end of a particular grade, the expectations for the next grade. We've talked to lots of second grade teachers who didn't know what was going on in first grade and vice versa, and so second grade felt like teachers weren't prepping kids, and first grade felt like second grade had expectations that were way out of whack. So really knowing the expectations for each grade moving forward and how the data can help folks mitigate those expectations and make sure that children are reaching the goals that have been set for them appropriately. And then, of course, I would say that we often set goals and collect data that are only about a fraction of what children really need in their development. And to make sure that data is being collected on children's social and emotional development, and that is used in appropriate ways to track and target resources to children most at risk.
Thank you, Danielle. I'm going to go back to the previous questions that we'd received. Hannah, this question is for you. Does the 12-month eligibility for CCDF equate to 12-month authorization payment, or is that subject to state definition? So I guess they wanted some clarification on whether eligibility is the same as authorization in the reauthorization.
That's a great question. So the law is, if you take the 12-month eligibility provision in kind of the context of the law, it really is about providing continuity for families and for children. It does not define eligibility. In the proposed regulations from the Federal Office of Child Care, there's a discussion in the preamble to the regulations which really clarify that these differences between eligibility and authorization are really not really go beyond what the intention was in the law, which was about getting children 12 months of continuous access. And so again, that's something that will be really important to have a final rule to really clarify for states that these distinctions are really beyond the point of the law. So it does say 12-month eligibility. We will be looking for states to implement eligibility and authorization and allow families to keep their subsidies.
Thank you, Hannah. The next question, Emily, this is for you.
Yep.
This question came in. What can be done to incorporate any of those needed child outcomes, such as wondering if children who do not receive physicals are actually healthy, or if food provided are beneficial or detrimental into their health in ways? Surveys are already too long and providers are getting exhausted with questioning. So I guess the question is, are there any recommendations or strategies that programs are approaching in order to address the type of questions that you mentioned that aren't necessarily captured in the outputs that you provided as examples?
Sure. So the list that I was giving were primarily things that get reported to the Federal Office of Head Start. I think that there is a lot more that gets captured. For example, programs are usually using ages and stages or a similar developmental questionnaire to look at children at different time points during the year in terms of some of those physical health and other indicators. So I wouldn't say it's not that the data doesn't get collected, it's that it doesn't get reported nationally, which is, on the one hand, as long as they're using it locally, great, and on the other hand, doesn't always answer some of the questions that we have at the federal level. I think in terms of what does get collected federally, and this is something that I believe Moneyball touches on too, it also becomes this question of, are there things that we could agree not to collect in order to focus on something that we might agree is more important, which is certainly something that the early childhood community needs to continue to talk about.
Okay, thank you, Dan. Emily. The next question is for all three of our panelists, and Hannah, I'll start with you. This person is interested in the panelists' thoughts on whether the federal government will enforce data collection requirements in the law. For example, the data reporting requirement that already kicked in for the Child Care Assistance Program on homeless children and children with disabilities, or data in CAPTA on whether children receive early intervention. What is the federal government doing to ensure that states will be able to report that data? And I know you guys can't speak definitively on that, but I guess it would be helpful to know, are you aware of any procedures at the federal level that's happening to monitor the implementation of these new data requirements?
Right. So this is Hannah. So certainly cannot speak for what the monitoring will be at the federal level. In terms of the specific data reporting, I can say that the CCBG administrative forms that are used for the data reporting have already been modified and are in use. Those were able to be done through some separate information collects, so it didn't require changing the regulations. So we do anticipate that we'll start seeing some of this specific data on the characteristics of children and families and some of this quality data in the next reports as they become publicized. Now, there's always a bit of a lag time in terms of states reporting data and then when the federal agency is able to publish it. But yes, we expect that that will change because those forms have already changed. In terms of additional monitoring, I think what we've heard is that the Federal Office of Child Care does intend to use the state plans and the state implementation plans that are in them, and to really have an ongoing process of monitoring to ensure that states come into compliance with the law.
Thank you, Hannah. Danielle, did you want to add anything?
Sure. I'll just say a couple of things. One, I think one of the most important pieces of the ESSA legislation is that the civil rights protections that were in NCLB are continued in ESSA, and that those subgroup analyses are the backbone of accountability and of making sure that kids most at risk are getting the services and supports that they need. And so, yes, I believe that that will continue to be a significant area that the federal government and that state advocates and other folks are looking at really, really closely. I will also add that there is a peer review process built into the state plans. So when states submit their plans, there will be some sort of group of folks looking at them to see if all of the requirements have been met. We don't yet know what that's going to look like and how the feds are going to structure that. There is the possibility it could just be a checklist and folks will go through it. Our hope is that it will have some real teeth and that those folks will be looking for things like these subgroup analyses and whether states are actually living up to the types of metrics and measures that are anticipated in the law.
Thank you. And then, Emily, I'm going to actually ask you to respond to the next question, which is for the group. Sure. We had a couple of questions and a comment just about, one had mentioned that HRSA has, so that the people are aware that HRSA has funded 15 states plus a national TA center to develop electronic data systems to maintain assessments for birth through age 3 to improve developmental skills of children age 3. I do want to note for people on the call that there are technical assistance agencies that are there to support states around data systems for the state longitudinal data systems, as well as early intervention and 619 preschool special education, the DAISY Center, and there's also a state capacity building technical assistance center to help states with implementation around some of these data pieces for the new law. So we'll be sure to aggregate those and put that together. So the
and the Head Start, the National Center on Program Management and Fiscal Operation provides some similar services for Head Start agencies.
Thank you. That was my question, Emily. And then if there are other ones that the presenters want to make sure that attendees on the call, supports that are available around these new requirements that they could access. Hannah?
So we have a number of resources on the CCBG reauthorization on our website at www.clasp.org/CCDBG. So, and people can contact me directly, and I'm happy to point you in the right direction.
And we'll include that on the Q&A that we send out. Danielle, is there anything that you'd like to add?
No, I think there are lots of resources on ESSA that they're still in development. EdTrust has tons of really good resources about the law in general. That's not us. We and others are working on really thinking about what the right set of resources are for the early childhood community, and those are in process, and stay tuned.
All right. Well, we're at 2 o'clock. I want to thank all of our presenters and let folks know that the about 3 or 4 questions that we didn't get to, we will respond to offline and include with the presentation, the slides, and the recording, which will be available on ECDC's website. So thank you all for attending the call today. We hope this was helpful, and thank you to our presenters. Have a good day.
Wonderful. Thank you so much.
Thank you, guys.
Bye.
Bye.